Okay, so in this patient example, we've done our initial read, we've brought in our data, our intraoral scans, we've done our CPR settings and drawn our nerves. And now in the teeth setup phase, if you decide you'd like to do a wax up, this is where you stop, okay? It automatically has our anatomy pulled up because that's what we named as anatomy, was the mandible. And notice the odontogram up here on the upper left is showcasing number 17 to 32, or the lower teeth. And that's because in the CPR settings, we chose mandible. Had we chosen maxilla, those numbers would be 1 to 16. So in this wizard, we have a couple different options. One, notice these lines that are showcasing through in the 3D rendering. That's showing kind of exactly where our 3D imaging is centered on right now. If you want to turn those off, on the top toolbar here, this far right one turns off the scout line. Okay, that middle one will turn on the scout line, and the one on the left will show the scout plane. And the scout planes are actually going to show you the 3D overlay too, which can be a little bit hard to look at. So usually just turn those off. Okay, I do have my nerves. You can see the 3D nerves here. And we're going to focus on number 19. So a couple things to keep in mind with the teeth wizard. It'll automatically have selected the select button. And what this is doing is it allows you to stop and tell the software where teeth are, because the software, as smart as it is, does not necessarily know that this is number 30 and this is number 31. So for instance, if I were to say, I want to select the teeth, let's say there is no edentulous site, we're doing an immediate tooth or immediate implant, and I say, this is number 29, and I just click on 29. All I've done is alerted the software that this area is considered tooth number 29. And that'll come into play more when we get to the next screen, and I'll show you what that does. If we want to actually add a waxed up tooth, we're going to switch the toggle to add, and then we'll select our tooth. So in this case, number 19. And we'll drop the little bobble right in the middle of the edentulous site. Okay, and what it's going to do is it's going to drop in a little digital wax up, which you can then manipulate by clicking on the tooth and dragging around from any size or from any viewpoint. And if you want to, in the 3D rendering, you can grab the corners and kind of tilt and spin and twist this tooth until it's perfect. It's easier to navigate that tooth in these slices on the right though. So it's nice to see the rendering to make sure you like where it is. But let's go ahead and showcase how to use it on this. So in the axial slice, if I zoom in with my right mouse button, I can grab the middle of the tooth and drag it around just the same. A little bit more controlled, however. And these blue circles allow me to click and twist this tooth around. Okay, so it's already in a pretty good spot, so we'll leave that be. Now, one thing that's nice, this is a pretty good spaced tooth for the space we have, but these little bobbles on the outside allow, if you click them, you can drag the tooth in or expand the tooth out. So if you need to make something fit, you can do that with, and even though I can't see this one, I can right click and change my transparency, and now I can see that bobble on the side. So if I needed to make this wider mesiodistally for some reason, okay, I'm going to right click on the model and change it back to opaque. Okay, now let's look at the coronal slice, and notice, as we can see here, we're hovering off the gums. So I'm going to grab the middle of that tooth and bring it down into the gum line. Okay, and that looking pretty good. We don't have to be perfect. This is just to help us treatment plan our implant positioning, right? And then we can take a look if we zoom in here and notice, hey, we actually are tilted a little bit up. So let's bring that tilt down more with the occlusal plane. And it looks like we're kind of away. We're not touching the distal tooth, so we'll back that up a little bit as well. Okay. And that's probably good enough for what we want to do. Now this could be, you can use this for all the teeth. You could do a wax up bridge from 6 to 11. It's really useful for these edentulous single sites, or if we're trying to plan aesthetic cases and make sure we have our implant positioning where the teeth will be best supported. But that is to show you kind of the ideal is how to just drop a tooth in. Make sure you select the add button instead of select, and you can then do a little digital wax up. One thing we could also do is if we want to bring in that top tooth, the top teeth, I should say, I can go to, on the far right, we have some object list. And object list will show you everything that we've added or taken away. Okay. And what's nice about object list, it doesn't actually like take you away from the panel you're in. It just is like a little toggled thing. And I can turn on my antagonist by clicking this little visual eyeball. And let's go back to teeth setup. Okay. And now I can just make sure, because this is in occlusion, if I want to make sure that's perfectly in space. We can toggle again, change the transparency here, take a look at, maybe that tooth is, if we're going to get really, really exact, but we're against the functional cusps, that looks good. So for all intents and purposes, we really like where we're at. Okay, so you can toggle on and off different views by going to object list and toggling things that have maybe been turned off automatically by the software. Okay, so that's our teeth wizard. If we want to add teeth, or we just want to tell the software where certain teeth are to make our next step a little bit faster and a little bit easier. So in our next video, we're going to talk about the implant planning, and there's a lot to digest inside implant planning.